There are new concerns tonight about our young children and the coronavirus, specifically that quickly spreading Delta variant. More than 125 campers and adults tested positive, and hundreds more may have been exposed after an outbreak in Texas. And that is raising concerns about whether or not it is too soon to send our kids to summer camps that they've been longing for. Correspondent Marky Martin has the latest from Dallas tonight.
These factors together during coronavirus have created a perfect storm.
In a weekend letter to the congregation of Clear Creek Community Church in Galveston, Texas, lead pastor Bruce Wesley canceling services for the week of July 4th, revealing that upon returning home from student ministry camp, more than 125 campers and adults tested positive for COVID-19. Asking for prayers, Wesley writes, "We are surprised and saddened by this turn of events. Our hearts break for those infected with the virus." Hundreds more were exposed, according to the Galveston County Health Department, which has independently confirmed 57 cases so far. More than 450 people, grades 6 through 12, attended that camp. The department reporting 6 cases as breakthrough cases, meaning the coronavirus infection happened more than 2 weeks after the patient's second vaccine. 47 cases are in patients 12 and older, and 10 cases occurred in children younger than 12.
Until we can get kids vaccinated, we continue to honor the ways to keep them safe.
Family physician Dr. Scott Connard is medically advising one of the largest sports camps in the United States right now and acted as the medical advisor for 24 companies during the pandemic. He says the choice to send your child to summer camp needs to be made on a case-by-case basis.
If I didn't have any high-risk individuals in the home, then I would be a little more relaxed than if I did. If I did, it would be black and white. I would be very, very aggressive about having them protect themselves and not bring COVID home.
Case by case. That was Marky Martin reporting for us in Texas tonight. Dr. Tina Tan specializes in pediatric infectious diseases at Lurie Children's Hospital here in Chicago. Doctor, appreciate your time tonight on this obviously important and timely topic.
My pleasure.
First of all, what is most important for all of us, especially parents, to know about the risks with the Delta variant and the impact that we're seeing it have on kids?
So I think people need to recognize that the COVID pandemic is not over, and that the Delta variant is known to be more transmissible. It can occur in any age group, and this is especially a problem in those persons that are too young to be vaccinated or who are unvaccinated.
What is the data showing in terms of kids' likelihood to end up in the hospital or get sicker from this particular strain?
So far, preliminary data is showing that in some instances, there is an increased risk of hospitalization with the Delta variant. However, in children, remember that most kids will have a more mild disease. However, that doesn't mean that some of these kids will not require hospitalization if they become infected with the Delta variant.
Given the fact, doctor, that kids under 12 are not eligible for the vaccine, I think that leaves a lot of parents pretty concerned. So what steps should they be taking to keep them safe? Should we mask up our young kids until we get through this?
So I think, they can go to summer camp, and it's expected that they should be able to go to school in the fall. But if they're too young to be vaccinated, they're really going to have to continue with the mitigation protocols, wear masks, try and stay within small groups, socially distance, and good hand hygiene. We know that this has worked throughout the pandemic, and it should be no different in a summer camp as long as these mitigation protocols are in place and those individuals that can be vaccinated get vaccinated.
I can't express the relief that I felt when my kids, 12, 13, and 16 years old, were able to get the vaccine. I felt like, okay, now I can protect them. But I know a lot of people who have younger kids who are still concerned. They feel that their kids are vulnerable. So in terms of timing for this vaccine, when they may become eligible, do we have a sense on when they will be able to be protected?
It looks like right now it probably be the end of 2021 or the beginning of 2022.
Okay. As you mentioned, school is quickly approaching. We're halfway through the summer, so I think a lot of parents are starting to focus on what will school look like in the fall. In terms of the Delta variant, we're not out of this pandemic yet. What is the safest approach in terms of returning kids to school in a couple of months or weeks?
I think that those individuals that can be vaccinated should get vaccinated. For the younger kids who are going to go back to all in-person school, it's probably going to be safest for those individuals to continue to wear masks and to socially distance in the classroom, as well as to practice good hand hygiene.
All right. Got a lot to work out as we await those younger kids to be eligible for the vaccine. Dr. Tina Tan, always appreciate your time. Thank you.
Thank you very much.
Coming up here on Prime, a devastating